Welcome back to CT Style. If you suffer from chronic pain and are looking for relief, our next guest might be able to help. Here now from New England Spine and Disc is Dr. Richard Carpenos and one of his patients, Thierry Decembre. Thank you both so much for joining us.
Hey, great to be here. Thanks, Natasha.
So, Doctor, you've been on the show before, but for maybe some first-time viewers, tell us about your practice and what you do.
So I own New England Spine and Disc, which is 391 Boston Post Road in Orange, Connecticut, the cultural epicenter of the northeastern United States. And we are at 1-800-PAIN-FREE if you ever want to reach us, and that's really the name of my game. We are basically concerned with patients not depending on opiates for pain relief and injections and surgeries. And so we've kind of taken on a bigger scope when I realized early on in practice that there were things that I couldn't take care of with my patients, like degenerative knee problems and elbows and shoulders. We could do some things, but we were very limited. And most of those patients ended up going for, arthroscopic surgeries or total knee or hip replacements, rotator cuff repairs, and the outcomes were not great. So
this is an alternative.
It's an alternative, and I think it's really the beginning of regenerative medicine. And so in the future, probably in the next 10 years, you won't be even seeing me. You'll probably get some regenerative medicine in the form of stem cell injections, but real ones that are not FDA approved yet. But this is the beginning stage. This actually activates your body's dormant stem cells to flood the area. This is a lithotripsy instrument. It's the only unfocused sound wave or shock wave instrument in the world.
Wow, and we're going to be doing a demo of this, but I want to hear from Thierry here about what brought you to Dr. Carpenos.
Sure.
A lot of people, struggle with chronic pain, and I know that's part of your story.
Right. So, the chronic pain that I was experiencing was more so in the cervical neck area as well as the lower back. I've had back surgery, and I've tried so many different therapies with a combination of prescription meds, over-the-counter meds, and it wasn't quite effective. So my twin brother, he actually called me up one day, and he gave me the whole demo of Dr. Carp, and I had nothing else to lose. And I said, okay, I'll give Dr. Carp a try. And I recall, upon first meeting Dr. Carp, he said, yeah, we're going to get you off the meds and you're going to be feeling good in a couple of weeks. I laughed, obviously, being a skeptic. And literally after a couple of visits, I threw away all the meds and I'm feeling a lot better nowadays. Yeah.
Well, that is, I'm sure, inspiring for a lot of people struggling with chronic pain. It can really impact, your day-to-day life.
Absolutely.
So I want to allow our viewers to see a little bit of how this device works. So walk us through and tell us about what you're doing.
Yeah, so this instrument has like a silicone sheath. There's saline fluid that gets pumped from behind the machine.
Yep. And
we are able to direct sound waves through here and into Terry. We're going to demo on his knee.
All right.
It's not painful. It can be a bit uncomfortable, but it's a 3-minute treatment.
Okay,
and the results are usually immediate. And if you can avoid taking medication or having surgery, I mean, to me, it's like a no-brainer.
So how many of these sessions do people need
while
you get started here?
So we are offering a $49 first treatment. The most anyone really ever needs is 8, but most people can get by with 6, and then those stem cells stay on the job. And even when you're not coming to New England Spine and Disc, they do their job, and over the next few weeks, you even get better.
All right, and I do want to, we have a full screen actually for that offer. I do want to pull that up while you get going here on Thierry.
Sure.
There it is, your special offer. It's a great offer for people. Why do you offer this to our viewers? What do you want them to gain?
Well, because like Thierry, everybody's skeptical. Oh, my doctor told me I need to take this medication or I need to have this procedure, and you may. I'm not saying that that's wrong, but if you don't need it and we can activate your own indigenous dormant stem cells to do some of the healing for you, then it's brilliant. Then you can avoid all that.
Well, Dr. Carp, I do want to tell people where they can go to learn more, NewEnglandSpineAndDisc.com. Thanks so much for the demo today, and I'm glad you're feeling better, Thierry.
Okay, thank you.
Thanks.